Good afternoon, doctor. Good afternoon, class. My name is Bryan Ramirez, and I'm going to talk about vitamin D supplements and prevention of cancer and cardiovascular disease. Definition: long prescribed to prevent and treat bone-related disorders. Supplemental vitamin D has been viewed in recent years as a potential strategy for preventing cancer and cardiovascular disease. Nevertheless, it's uncertain whether supplementation with vitamin D prevents cancer or cardiovascular disease. Applications in medicine. In this large primary prevention trial, supplementation with vitamin D3 dose of 2000 IU per day didn't lead to a significantly lower incidence of invasive cancer of any type or a composite of major cardiovascular events such as myocardial infarction, stroke, and death from cardiovascular causes than placebo. The intervention also didn't lead to a lower incidence of total deaths from cancer or a lower incidence of breast, prostate, or colorectal cancer than placebo. Pros and cons. Pros: BMI may have modified the effect of vitamin D on cancer. Vitamin D may decrease tumor invasiveness and the propensity to metastasize. And vitamin D may confer greater protection against cancer death. On the other hand, cons doesn't decrease the incidence of invasive cancer or major cardiovascular events, doesn't decrease total deaths from cancer or a lower incidence of breast, prostate, or colorectal cancer, and despite high dose of vitamin D, there were no significant benefits. Usage applied in Ecuador. Vitamin D deficiency is a problem worldwide and in Ecuador. Epidemiological studies have shown a deficit of vitamin D according to the age group, predisposing factor important for the development of bone pathologies and other conditions, which recent studies proposed that the incidence of cardiovascular disease and cancer decreases. Conclusion: vitamin D increases musculoskeletal health and reduces mortality associated with bone problems in some population groups, especially in the elderly and other risk groups. But it did not lead to a significantly lower incidence of invasive cancer of any kind or a combination of major cardiovascular events, such as myocardial infarction, stroke, and death from cardiovascular causes.